Hello, welcome to this Neurology Station for MRCP PACES. My name is Dr. Punika and I'm the examiner. Along with me I have Dr. Samira Suhail, who is the candidate for today. Hello.
Hello.
Okay, so we've just seen this patient that you've examined. Would you like to present your case, please?
I have just examined this 76-year-old lady. On inspection of the eyes, there is a partial ptosis of the left eye. Further examination of the eye reveals that pupillary reflexes were intact.
Okay.
There was an ophthalmoplegia on examination of the eye movements, which was consistent with a left third nerve palsy.
Okay.
In a sense, my diagnosis is a partial left-sided oculomotor nerve palsy for this patient.
Okay, that's good. Let's just try and understand why this patient may have had a left third nerve palsy. Can you think of causes for a left third nerve palsy, please?
There can be several causes depending on the site of the lesion. So the third nerve can be affected at the level of the midbrain, at the level of the nucleus in the midbrain, and this can be caused by an infarct, a hemorrhage, or a tumor.
Okay.
As it leaves the midbrain and enters the subarachnoid space, this may be affected by an aneurysm of the posterior communicating artery. In this case, it will be a painful third nerve palsy.
Right, okay, good.
As it enters the superior orbital fissure, it may be affected again by a tumor or an aneurysm of the internal carotid artery. But in that case, I would expect some involvement of other nerves, such as the fourth nerve, the first and second branches of the fifth nerve, and the sixth nerve as well.
Okay, good.
It then may be affected within the orbit itself, for example, as a result of any tumor or trauma.
Right, okay. Can you think of any other causes that might affect the nerve along its entire length, wherever?
Another common cause for third nerve palsy can be diabetes, such as a microvascular complication of diabetes causing a vascular neuropathy.
Okay, so say for example a patient comes to you who you are suspecting has had a diabetic microvascular mononeuropathy involving the third nerve. So the patient comes to you and asks you, "What is my prognosis, doctor? Am I likely to get better?" What would you say?
The prognosis is generally good and most of these patients will self-recover.
Right, okay. How long do you think it might take to recover from a diabetic mononeuropathy?
Weeks to months.
Right, okay. That's good. You mentioned that the pupillary reflexes were intact here. Does that have any bearing on what the causes may be?
If the nerve damage is related to a tumor or a trauma, then I would expect the pupil to be affected as well. But if the cause is a vascular neuropathy, I would expect the pupils to be spared.
Right, okay, that's good. Excellent.
Thank you, doctor.
Thank you.
Thank you.